Okay, Jess. So, um, just a few things to reflect on today before you go. Some things I noticed when you were working with Beth. Try to keep in mind you want to compare bilaterally so you have an accurate assessment for that specific patient on what one may be compared to the other. Because if one is injured, you want to see what's normal for them. And you can also measure and write that down. Don't feel bad about spending a second writing down that measurement if you use like a goniometer to measure. That way you don't forget and you can document it for later. I know I have to kind of take a second and write things down sometimes when I use measurements. Okay? And also try a really big thing you want to try to do is stay engaged in the environment. So even if you're giving them, a 30-second rest or a minute break, whatever you're doing, try to stay engaged. Talk to them. Um, Make sure that you're not on your phone, things like that. You know what's going on and you're kind of bonding in a sense with your patient. So they know that you care rather than you care more about what's on your phone. So maybe try to leave our phones in our pockets, things like that, leave them off to the side and make sure we're really staying engaged in our environment.